media discourse in this period, in the past weeks, this idea of health providers being heroes was really so widespread. And I was wondering what this discourse suggests you, which reflections?
We've seen a lot of that rhetoric about care workers being heroes, and in a way it's a double-edged sword, because of course this has put to the fore the role of care workers in our society. There was a lot of public attention, also a lot of public support, but why is it a double-edged sword? There is also a quality of heroes that we expect them to be able to do basically anything. The heroes are supposed to be able to sacrifice. And this is why it can be a little bit tricky, because this is not what healthcare workers have signed up to do. Of course, their role is very important, but we also need to keep in mind that actually it's a job, and the working conditions need to be safe. So in a way, even though it has kind of foregrounded their role and put them to the fore, it doesn't do them a favor or a service to frame them as heroes, because then it means that anything can be expected from them.
I think there's quite a large proportion of carers that are from a sort of Black ethnic minority background. Do you think this is something that's been acknowledged in the public discourse when they've been chatting about the healthcare workers as heroes?
I don't think it has. I don't think it has been acknowledged very much, even though we had this narrative and discourse about workers as heroes. That was a dimension of this reality that still remained invisible to some extent, because actually among the healthcare workers who have the most face-to-face time with patients or with residents in nursing homes, for example, these tend to be healthcare workers, healthcare assistants, and among these healthcare workers, many of them are either migrants or minority ethnic workers. So, and there are a couple of reasons why it's important to foreground this dimension as well, because many of these workers, especially migrant care workers, are on precarious administrative statuses. They don't always have stable residency rights. And part of acknowledging their role and their immense contribution to keeping the care and hospital system afloat is also making sure that they actually have their rights respected, and this includes residency rights.
And also I was thinking that there are migrant health workers working in hospitals, in structures, in institutions, but there are also private care workers, migrant care workers employed by families. So I was wondering what are the implications of being a migrant worker during a pandemic? So in a period when social distancing is required, when there are widespread fears in society about other people.
Yes, we all have seen, I mean, also in our personal situations, how that is a health crisis, a sanitary crisis, has actually become a mobility crisis. For many of us, it was probably the first time we were limited in our mobility. And that condition, of course, was even worse for people who are normally limited in their freedom of mobility, as the migrant who are dependent on a residence permit in order to be where they want to be. So we have two different situations: those who are regular migrants in a country and those who are already irregular migrants in a country. for the regular migrants, the situation is quite complicated. In the case they have lost their jobs or they have reduced the number of hours in their jobs, when these jobs are the reasons for their residence permit. So they might have lost the entitlement to a residence permit because of these, let's say, job crisis for them. We have several studies that have shown how in past pandemic or health emergencies, migrants of different origins have been target of racist attacks. That has happened from an Italian perspective, that has happened in the very beginning of the pandemic back in January, where Chinese people, even Chinese students, Chinese youth were object of offense, etc. This is not happening anymore, but we never know if that could probably very easily coming back. That could be also from the side of the families for which these migrants work as caregivers. They might be implicitly object of fear or suspicion by the side of these European families, for example. If you were a living worker, so living with, for example, the elderly person you take care of, you might have been asked to stay home with this person on a stable basis, so be denied your day of your rest day or your hours of rest in which you can go out because they are scared that you might meet other people, etc. So that's a very important violation of your labor rights in terms of caregiving rights. At the same time, live out workers, so those who live in their places and they come to work as a nanny, as a cleaner, as a caregiver, they might have been asked not to come and not being paid, therefore. So their jobs might have been put in standby for a few weeks, if not a couple of months. They've been forced to take holidays in case they had the right to paid holidays, or they might have been asked to decide for themselves what they want to do. So the moral responsibility was put on their shoulders.
So domestic workers, of course, are facing difficult economic situations. Are governments doing something for this, taking any measure for solving these problems? For example, is the French government doing anything particular, Nina?
Not really. What we have seen emerging mostly were several initiatives by activists, by academics, to bring this, this question of care workers even more to the front. But I would say that these have mostly focused on care workers, on the broader category of care and medical workers, and not necessarily on migrant workers per se. One of the directions this has taken was really to use this political momentum to be able to foreground the inequalities that have marginalized care work for so long, and one of this underlying bias is about the non-recognition of emotional labor. That's one of the reasons why care work is being so marginalized, not acknowledged as being skilled. Earnings are low, working conditions are tough. So in terms of concrete policies, what we have seen for now was first an offer or a proposition by the French government to have a one-time financial benefit for all the health workers who were involved in fighting COVID-19. So it was a financial benefit of around €1,500. But as soon as it was announced, it was already very, very clear that this didn't meet the expectations of healthcare workers, because the struggle is about improving conditions in the longer run.
Sabrina, has the Italian government, how have they reacted?
Okay, the Italian government had a two-step reaction, so to say. At first, in the government decree of last March, giving financial support to people in who lost their jobs, or they forgot about domestic and care workers. They were not mentioned at all, which was a bit of a paradox, because the name of the decree was Care for Italy. So it was a kind of paradox that those who actually cared for Italy were forgotten by it. They started several complaints about that from the side of scholars and academics. I was also involved in one of these appeals for more rights for domestic and care workers, migrants especially, but also from the side of trade unions and different stakeholders. There was a complaint about that treatment. So with the new decree that we have now in place for the months of April and May, domestic and care workers can also apply for a subsidy in case they lost their jobs or they got a reduction of their income. Surprisingly, that subsidy is 600 euros for all other jobs and 500 euros for domestic and care workers, which is a big problem. I mean, I don't think that for domestic and care workers, their everyday life is less costly than for other workers. So we again see the tendency to consider these category of workers as a second level category, a sui generis category of workers, as we say.
In France, at the beginning of a pandemic, there were shortages of protective equipment, especially masks. Of course, it varied from hospital to nursing homes and to regions, etc. But at the very beginning, there were certainly shortages of masks that were covered very much by the media as well. But this kind of linking up to what we're talking about at the beginning of the conversation around this rhetoric of that's one of the reasons why it was also problematic to use that rhetoric, because healthcare workers and care workers were very much celebrated also by politicians from the very beginning of the pandemic as heroes. So they were called, I'm not sure that's the right translation in English, but I believe something like heroes in white coats. So that was used, again and again, and while it might seem as some kind of recognition, when you hear that in the context of actually healthcare workers and care workers not having enough protective equipment, that's really, really problematic.
Do you think in quite a lot of countries now, so in the UK, I think this will possibly become a concern for families where they previously would have had their elderly parents in a care home. Possibly now they're concerned about care homes being not as safe as they were thought to be. Do you think there'll be a change in who provides that care?
Yes, I'm actually very worried about that. I think what has happened is a big challenge, a big obstacle to the spread of what we call a more institutionalized form of care provision. In Italy, that's not the standard model. Most of Italian households do keep the elderly or ill people inside the homes. Actually, the part of Italy which was more impacted by the pandemic, so the north of Italy, Lombardy, is one of the areas in which instead nursing homes are rather common, or let's say more common than in other parts of Italy. So it's pretty tragic that that system has been impacted so much. That might be badly seen in the eyes of also other people in the rest of Italy. And that might mean that those cases of elders or chronically ill people will return in their homes. Returning in the homes is a worsening of situation, is a worsening in terms of the rights and protection of the workers, but also in terms of the type of care, the type of assistance that these people receive, which is of course better in a sort of institution, in a nursing home, in terms of medical care and also psychologically speaking, to be in an institution with other people has been proved to be in many cases, not always, but for some cases, really ideal for patient. So we are going to see a crisis of all of that, which was actually an achievement in my eyes.
Yeah.
In the context of domestic work for care workers who are even just working in the home, or who are live-in workers who live with the persons that they take care of, the conditions, the working conditions tends to be really tougher and worse than in institutional care, because it's also less regulated. It depends on the employer, so you can find a really important variety of situations with also frequent abuse. So if we really see a wide shift to home-based care, this is something that we really need to pay attention to, how the sectors are regulated and how we make sure that care workers who are very often migrant care workers, how their labor rights are respected, because this is something that's harder to achieve in the home-based context than in institutional care.